Hey there, my name is Dr. Lisa L. Campbell. I'm known as the Growth Motivator, and today I want to talk to you about 32 years in healthcare with a focus on lessons in growth, leadership, and impact. I want to thank Dr. Jenkins for this opportunity to present this to you today. So, this is not going to be a long conversation. I really wanted to talk to you about being intentional with your healthcare career, but also note that even with the best of intentions, life happens. Life is lifing sometimes, right? And so, I don't want you to be discouraged whenever you have a setback, because honestly, sometimes when you sit back, you sit up with a little bit more grace, a little bit more power. So, three tips for you today. And the first one is to be a lifelong learner. Let me tell you, when I set out to begin my career in healthcare, I said, I got a family full of nurses. Maybe I'll be a nurse. And then I was like, oops, I just had a baby. So maybe nursing is not the way to begin this journey. And prior to healthcare, I was a manager at McDonald's. Definitely helped me understand how to manage the front, the middle, and the back end of a process. Just like healthcare, there's a front, middle, and back end revenue cycle. I actually learned that concept at McDonald's. So I went to school for medical assisting, and I was like, I like this healthcare. And working as a medical assistant was really cool. I was literally forced into medical coding, medical billing, medical records. And I was like, I didn't go to school for this, but I embraced the opportunity to, continue to learn. And so what that did was allow me to grow. So as you see here on the slide, I definitely did not stop at medical assisting, but quickly realized that I did not want to be a nurse and pivoted just a little bit into healthcare management, healthcare leader. Ever since I was 5 years old, I was a leader. I was a person who was intentional about the decisions that I made. And so you could see here, I just literally kept going. Now, I'm not saying all of this to brag. I'm not saying all of this for you to duplicate this journey. Every move I made was strategic. So, I went to medical assisting school because I was a young mother. I needed to make a better life for myself and my daughter. But then when I got into healthcare, I was like, sometimes you got to talk to yourself. I said, self, you need to be in charge. And so I went and got the bachelor's and the master's degree. I went straight through, focusing on healthcare administration. Then, after working in healthcare for about 5 years, in 1997, I had an opportunity to teach medical assisting, medical coding, medical billing, right? All the things. And as I was going through the master's program, finished that, was teaching at this university, and I said, how do I make more money here? Because I wasn't making a lot of money teaching. And they're like, oh, you either have to get a second master's degree or a doctorate degree. Now, fun fact, I said to myself, who in the heck needs two master's degrees? Now, if you notice on the very top, I did go and get a second master's degree, but it was a reason for that. But I got the doctorate degree literally so I can make more money. Little did I know how much of an impact it was going to have on my life. Now, I have an addictive personality. And in addition to getting the academic degrees, I have 11 national certifications and most recently became a fellow with the American Health Information Management Association, also known as AHIMA. And so these certifications were by design, right? So when I first got certified, I was a medical assistant. That makes sense, right? And then I kind of shifted into medical billing, medical coding, and as you can see, kind of got different certifications. But it didn't just stop there. I had a passion for documentation integrity. I had a passion for compliance. And so I got those certifications as a way to basically show others my level of expertise, right? But it's not just the certification, right? You got to be able to do what the certification says you can do. So, embracing lifelong learning is something that you have to understand because with our credentials, we have to get continuing education, right? So, you're going to be constantly learning. And I will ask you, are you going or will you be left behind? Those that are lifelong learners, and it doesn't have to be formal education, it could be a book. For example, one book that I've have revisited recently is The Strength Finder, which really reaffirmed for me what my strengths were, but also made my mind say, these are the things that you need to focus on. All right, so that's tip number one. Tip number two, cultivate your network. In this industry, it's not just what you know, who you know is as equally important. And so I am a member of 4 organizations, and each of these organizations offers me something different. And while there are some overlap in terms of who's a member of each organization, for example, there are some medical coders that are members of the AAPC, but also members of AHIMA, but there are some that are not. And so in each space, I have a network of resources that I can tap into. And let me just tell you, one time I was at a conference for AHIMA. We were in Denver, Colorado, and I met this young man. He's older than me, but he's still a young man who said, "Hey, don't you do a lot of provider education and focus on like pro fee professional services coding?" And I'm like, "Well, yes, I do." He's like, "My company is hiring." Left that conference next week, flew out for an interview, and worked that position for 3 years. Not just about what you know, who you know is equally as important. So cultivate your network and don't just be a member of an organization, volunteer so people can know who you are, right? Know what your strengths are and where they could potentially bring you in an organization. All right, tip number 3. You have to be resilient. Life is always lifing. It is so important that you just continue to stay in the fight. And for me, my fight is always being ahead of what everybody else is doing. So, for example, artificial intelligence, right? I'm all in with artificial intelligence. And there are some people who are fighting it. Again, are you going or will you be left behind? So, my mindset is resilient and I keep fighting to live another day by staying ahead. Reflect on what opportunities you've had prior to healthcare. I worked at McDonald's as a manager. I could manage the front, the middle, and the back of the store, right? No experience left behind. Don't let anyone say, you don't have any healthcare experience, so you can't get a job. You have experience. When I got hired at Cook County Hospital here in Chicago in 1999, I asked the medical director, like, why did you hire me with no healthcare management experience? He said, well, honestly, I figured if you can manage the folks here, if you can manage the folks at McDonald's, you can manage the people here. And he was absolutely right because I collaborated with those who I was leading. So it is very important that you have a balance between your personal and your professional life. Don't just be so healthcare focused. Get involved in things that are not healthcare, but help support your healthcare journey. And lastly, if you want to stay in touch with me, here's how you can find me on the various social media channels. You can also just Google Dr. Lisa L. Campbell, the Growth Motivator, and you will find me. I hope this was helpful. Have a great day.